The interesting thing about Kaiser Permanente is it is a strategic partnership between three separate corporate entities, but they work together. The Kaiser Health Plans, Kaiser Hospital, and Permanente Medical. Kaiser Permanente Health Plans is like the insurance company, and Kaiser Hospitals, they manage the hospitals, and the Permanente Group is a group of physicians, a for-profit group of physicians who function independently and are responsible for care and quality of care. This right here, this is the problem with the current U.S. healthcare model, is that everyone has to fight over money, and this is a big waste of technology and time. One of our classmates is talking about using artificial intelligence to improve the billing. Some insurance company, I'm like, well, gee, I dated a claims analyst from that insurance company like 20 years ago, and they only pay 75% of their claims regardless of their validity. This still goes on if you read the news. There's just insurance companies that don't pay any more than a certain percentage of claims, and all they have to do is come up with some reason and then fight with you about it. And so this is one of the biggest problems in U.S. healthcare. So there's this tug of war between the medical providers and the third-party payers. The entire time I was in practice, the billing clerk would hand me the phone and I'd have to argue with somebody on the other side of the phone as to why what I did was completely appropriate, and the big words I was using was in a different dictionary that they actually did not have on their desk. This is the problem with the U.S. healthcare model. In my opinion, I'm sure there's a few other doctors that would agree. By the way, while we're on the subject of tug of war and something called culture, we talk about corporate culture in business school. And the discussion of corporate culture is completely missing from the U.S. healthcare model. And so not only do the poor doctors have to play tug of war with the insurance companies and the third-party payers, the doctors have to play tug of war with malpractice attorneys as well. And the malpractice attorneys will tell you that they've done nothing to increase the cost of health care. But what I can tell you is that the environment of litigation that people practice, that the physicians practice within, has created a culture of wasteful spending. And so now our healthcare workers are in a rock and hard place, playing tug of war over the buck with somebody, which is basically why I'm in business and teaching at this point in my life. Well, the interesting thing about Kaiser Permanente is they're a strategic partnership between the insurance company, the physicians, and the hospital. So they all kind of work together as a team to do what's right. And, you know, actually, they're using this model in the U.S. as the model for accountable care organizations. Accountable care organizations are when insurance companies, doctors, and hospitals get together and come up with some kind of strategic partnership so they're not fighting with each other. And who did that first? These people did it first, all right? That means that Kaiser Permanente is vertically integrated. So it's Kaiser's Permanente strategic partnership. It's vertical integration that gives it the distinct competitive advantage over the traditional model. And since this is a course of data analytics, we'll actually talk about Kaiser Permanente and its data analytics. So the strengths of Kaiser Permanente's system, they have a history of giving universal coverage, and that's different than some of the other terminology that's being thrown around. It's the same thing as integrated healthcare. The insurers, the doctors, and the hospitals, they work together to come up with an algorithm so that they don't sit around and fight with each other all day long. In business, we call that vertical integration. But what's interesting about Kaiser Permanente is they generate so much data that they can do some really incredible research in a very short amount of time because of this big data and the analytics. All right. It could be a weakness that they only serve 8 regions. That's from an article I read. Kaiser Permanente serves these regions. But one of the weaknesses of Kaiser Permanente is it's very capital intensive to bring this integrated system into new markets. I think the major threat for any insurer is this right here, unstable government policy. Nobody was really sure what was going on 8 years ago, and whatever's going on 4 years ago is kind of eroding away. We have no idea what's going on 4 years ahead, and so that's what makes healthcare unique from some of the other businesses in the United States is, you know, we really just have no idea what healthcare policy is going to be 2 years from now, 4 years from now, and then once they change it 4 years from now, it'll get changed again. All right. Single-payer healthcare, I think, is a threat to United States healthcare system. I think it would be incredibly devastating. If you know what federal sequestration is, then you would understand where this icon comes from. And so I think last night they were talking about getting rid of insurance companies and letting the government take over. Problem with that is the U.S. government, their core competency is not in healthcare funding. They think it is, but it's not. And so single-payer healthcare and unstable government policy, these are threats not only to Kaiser Permanente, but U.S. healthcare in general. You can read that if you're interested in the Porter 5 forces. But anyway, Kaiser Permanente and a lot of us in healthcare, including you watching this, have an opportunity with all of this subterfuge going on because there is this demand for universal coverage because a lot of us believe that healthcare is a human right. I'm assuming that you're taking a pharmacology course because you want to take care of other people. That's why I got into this business, because I want to take care of other people. And yeah, I think healthcare is a right. That's why you can go to an emergency room having any kind of emergency, and people will take care of you because healthcare is a human right. And so there's a demand for lower costs and better process. And I don't think the lower costs and better process are going to come from the politicians because they think there's a single answer for things, and there's not. It's very complex. There's a multitude of things that have to happen to lower U.S. healthcare costs and improve the process. And we're going to have to do something about the inefficient model that we have going on right now. And so I think Kaiser Permanente can capitalize on this because their history is providing universal coverage without government intervention. HIPAA stands for Health Insurance Portability. It's kind of like a Visa card. You know, it doesn't matter what bank your Visa card comes from. You can have your arrangement with the bank, but when you use it to purchase something, the rules are basically the same. And this is what we wanted to do with HIPAA when HIPAA came out. HIPAA was supposed to give us health insurance portability so that all the players use the same rules. But they didn't use the same rules, and so there had to be accountability for those insurance companies that were not following the rules. And that's what the letters of HIPAA stood for: Health Insurance Portability and Accountability Act. Well, all that portability and accountability for the insurance companies, that kind of got swept away, and what was left behind was this draconian patient privacy business that we use to come down on nurses when they're talking about patients. All right, so anyway, Kaiser Permanente has been involved in universal coverage for the last 50 years, and that's why the government comes to them for certain questions. All right, Kaiser also spends billions of dollars on their electronic medical record systems and other data collection systems, and that gives them a distinct advantage in big data. And so if we look at the Center for Health Research and their computer system and what they use to process data, they use something called Oncolog for their oncology cancer registry, and it is a data management tool. As well as ARIA for their radiation oncology. It's a complete package, electronic medical record, allows them to do data analytics on cancer patients as well. They use Clarity for key performance indicators. They use a healthcare effectiveness data information set, one of healthcare's most widely used performance improvement tools. And so they have all sorts of data sets, member surveys, provider information that comes from Permanente, their electronic medical records. They have vital statistics. They take information from the Census Bureau. They have a data warehouse where they get information from their pharmacists, dental histories, lab pathology, all sorts of stuff. You can sit there and swirl around the whirligig and see that Kaiser Permanente has an enormous amount of data that they can use and integrate into their various 2,400 research projects. And so here's some examples of some of the research projects they have going on to control quality and deal with quality improvement. Right now they're looking at the use, their role of opiates in suicide risk. They're evaluating their diabetes prevention programs, addressing racial disparities in healthcare. This just came out yesterday. Using varicella, the chickenpox vaccine, actually lowers the risk of pediatric shingles. This is something we've known from common sense, and now the data is starting to show that. Vitamin D doesn't seem to contribute to decreasing risk of type 2 diabetes. The effectiveness of the mail-in cancer screening tests, they're doing this at federally funded health facilities for people with no insurance, as well as this new tool called the Cardiovascular Risk Wizard. They're trying this out in the uninsured. The economic impact of uninsured families with children with chronic illness. And so they're using big data to do thousands of research projects to see what can we do to control costs, because it's not one simple solution like the politicians are trying to tell us. It's actually the 2,400 different solutions, and we're getting this information from data analysis, and that is how we need to affect healthcare policy. Not only does Kaiser Permanente use data analytics as the driver in cost control, quality improvement programs within their own organization, they're actually doing data analytics to show the economic impact on the United States of having so many people who are medically uninsured. And so my goal, Kaiser Permanente goal, many of you watching, your goal is to get paid for taking care of these people, and they need to have health insurance. One of my big problems when I was practicing medicine in Ohio, I take care of all sorts of uninsured people, and all sorts of other people would say, well, they shouldn't have health insurance because of X, Y, and Z. And I'm like, well, I'm the one taking care of them, and then I'm not getting paid to take care of them. And so when you think someone should not have health insurance, remember, they can go to an emergency room and get taken care of. And then if you're the one that thinks that they shouldn't have health insurance, then you think that I should be taking care of them, or somebody else should be taking care of them for free. And that's not going to work out in the long term. And Kaiser Permanente taught us this 50 years ago. So yes, healthcare is a human right. There are people working on it. And last night during the debates, the politicians seem to have an answer. I can assure you the data analytics is going to provide a much better solution than from anybody who talks about healthcare on television.